You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. He has a training institute where doctors from all over the world literally come to learn about implant dentistry. With us, we have Dr. Panjali. Dr. Panjali, welcome to the program.
Thanks for having me.
Good, good. Now, everything we talk about today, you teach other dentists. Is that right?
That is correct.
So tell us about, for people that don't know your training institute, tell me about it.
So the Training Institute basically has a program for dentists who have never placed an implant to people who are placing implants. They're very good at doing and they want to learn some more stuff, some more expert techniques that they want to incorporate into their practices. But more importantly is the services that they're going to provide at the end of the day to their patients. You know, with whatever knowledge they come in with, my job is to improve them and give them something new that they can take back home and help these patients out.
Okay, good. Now we're going to start off right off the bat. In your practice, routinely, somebody can walk in on the day of the procedure with no teeth and walk out the same day with upper and lower teeth that don't come out.
Is that correct. True? That is correct.
Is that common or rare?
Yes, it is very common. Okay. It is very common that we do it. Every single patient who comes in walks out with teeth. They don't have to. They don't have to walk without teeth.
Okay.
That's pretty much the standard of what we provide to our patients.
Okay, good, good. Now I know you brought a stack of photos. We're going to get to as many of those as possible. But who's the typical dental implant patient these days that you see?
A typical implant patient is mostly patients who have been either denture wearers for a long time, or people who are just totally disgusted by the fact that they have to go time and again and get the get root canals done, get crowns done, and then they fail. Then they have to go for another procedure. So they kind of get just tired of going back and forth with the dentist for the same problem again and again, and not to mention about the pain that they are going through. I mean, every single patient who comes into my practice says, you know what, doc, I'm just tired of this thing. I'm just tired of going back and forth. Can you do something for me that I don't have to go through this pain and agony again? And they're all heading towards these dentures. All these patients are heading towards these dentures, and they say, we don't want dentures. We don't want to take out something in front of my wife or my girlfriend or my people, or I'm an executive. I work for this company. Depending on what their needs are, most patients would tell me, I do not want things that will come out. Okay. And that's important.
That's what you do.
Yes, exactly.
So you think dentures in the future will be gone? That means dentures as we know them today, they'll all be attached to implants in the future? 20 years, 50 years from now?
I think they should be.
Okay.
I very strongly believe that every patient has the right, everybody has the right to live a good life. And when I say life, I mean they're just a regular lifestyle. They're eating, they should be able to chew well, they should be able to smile when they go out. They should be able to do all these things.
Yeah, but what if you have gum disease, like bleeding gums, infected gums? Are your gums too bad to get implants?
That's what we do every single day with all our patients. These are the typical patients who come into our practice and they say, well, we are sick and tired of going back and forth, getting cleanings done four times a year. We have to go back and do a lot of medications that they have to take. They are still having bleeding gums. They have foul smell coming out of their mouth and things like that. These are the typical patients.
And that goes away?
That goes away.
When you get rid of the infected teeth, clean it up.
Absolutely.
Now in New York, and New York's a big place, but
yes,
are there a lot of denture wearers
my God.
or headed to dentures?
Oh my God! If I tell you that right around where I am, I can probably fill the Yankee Stadium twice with the number of people, if not less, at least twice. I can fill them up with the number of people who are wearing dentures or are without any teeth. Okay. Let me put it this way.
Well, if implants are so good, then why aren't, if there's so many people, right? Hundreds of thousands, why aren't they all coming in to do it? What's your take?
Well, my take is, so there are some facts. So this is what happens. Okay. When a patient comes and gets dentures, that's the first reason. Patient comes and gets dentures, he's now out of the recall system, completely out of the recall system.
He doesn't
which
go to the
means he
dentist.
doesn't have to come back. He'll just come back for a few adjustments here and there, but he doesn't come back to the practice again to listen to or get more options. So people who are wearing dentures, they're walking around wearing dentures not knowing what their actual options are.
Because they don't go to the dentist.
They don't go to the dentist. So they
point.
don't
Okay.
have the options.
All right.
Nobody presents them with the options. And so that is the number one reason. Number two is that there are people who repeatedly keep going back and forth, fixing their teeth, not getting anywhere. Okay? That means they get a root canal done. Tomorrow the root canal fails. Now they have to get a crown lengthening done. After the crown lengthening fails, now they think about an extraction. So now they talk about a bridge. Then the bridge fails. It is an ongoing story. It's
So
just
they
on
get
and
their
on and
teeth
on.
out, and the last thing they want to do is go to the dentist.
Exactly.
Again.
Exactly. And when these patients come to me, and I can show you one of my patients here.
All right, let's take a look.
He is a gentleman, and this is a very interesting story you will hear. This guy came to my office around 4:30 when I was about to close.
Okay.
He was dressed shabbily, and he came in for a consult. As you can see, his teeth were really, really bad at the time he walked in. And he came and he says, "Doc, what can you do for me?" And we discussed implants. And he did the consultation and he went away. I never saw him for 2 months.
Okay.
2 months later, this guy walks in right around the same time, 4:30.
Okay.
He comes in and he gives a check in the front desk and says, "I'm ready to go."
Okay.
I said, "That's fine." So we did some preliminary work that we have to do. We take some x-rays, and right around, it was almost like 5:30. Everybody had left the office. I was one of the last ones to leave the office.
Okay.
I was going to the parking lot to get into my car. And I saw him there, and I said, "What are you doing here?" He says, "I'm just waiting for a ride." And he says...
So he just got his new teeth.
No, he didn't get his new
Didn't
teeth.
get his teeth yet.
Just a consultation.
Okay.
He just paid for the treatment.
For the procedure in advance.
He just
Okay, I
got
got it.
started. We started with the scanning and everything.
Yeah.
And I said, "Yeah, but didn't you have a ride? Last time I saw you, you had a truck." And he says, "Yes." I said, "Where's your truck?" He says, "I sold it." I said, "Why?" He says, "To get my teeth."
Wow.
And I said, "Oh my God." And he says, I said, "How are you going to work? You're a construction worker. How are you going to go back and work if you don't have the truck?" He says, "Doc, I cannot work. I can't eat. I can't chew. I can't lift things. I am just losing my health. I'm losing my job. I'm just going downhill. I don't have the money to pay you so much, so I had to sell the truck."
Okay.
This man, we did his work, and now you see his other picture afterwards, all right? You see his picture over here, and this guy is now a company executive. He's a partner in a company. He got married about 2 months after he got his teeth.
Handsome guy, looks good.
Okay, he got engaged to this wonderful girl. He's got 2 beautiful kids, and he now owns a company as well.
Does he tell you this? Like he says, this was like the start?
Yeah.
Good.
And when I called him and I said, "How are you doing?" I said, "Can you send me a picture of you?" And I couldn't believe that this is what he looks like.
So he sends you this photo like a selfie.
Yeah, he sent me a selfie.
Those
and he
teeth
says,
look good, by the way.
Yeah. And he said, "Doc, I can't be happier." He says, "I can smile now, I can eat now, I can go and present my cases." He goes and bids on construction works. He's able to smile, he's able to talk to people, he's just so excited about having just that smile where he has the confidence.
Good.
Instead of working for somebody else, now he's working for himself.
Interesting. Now, is it more women than men or kind of a mix? Because men
It's
put
both.
things off to the last minute.
They do, and it's also because of the fact that men are a little bit lazy, I think, to a certain extent. They just keep putting off things. But we have both men and women who come to the practice with different issues, different.
What about husbands and wives? Do they ever come in together? Like one gets it first and then the second one?
I can recall a few couples, yes, quite a few couples that have done this, where the wife would come in first, and typically if that happens, wife would first send the husband in.
Okay.
I don't know why, but the wife would send the husband. He says, "Well, let me see how you do, and then I'll get the work done." So, the guy comes in and says, "Dr. Panjali, My wife has sent me, I'm your guinea pig. Okay?
Okay.
So you do.
And then in one day they get their new teeth.
Yes, exactly.
How long does it take the wife or their partner to finally say, I got to get in there and do it too?
Well, I'll tell you, the very first day when they walk out of my practice with the new teeth in their mouth, the wife's or the spouse, whoever that spouse is, the reaction is, wow, you look great. They're already looking great. Doctor, are you already done with the case? I said, no, I'm not completely done. But yeah, she has teeth in her mouth that she can...
That don't come in and out.
That come in and out. They were fixed. You don't have to take them in and out. And she's good to go.
Okay. I mean, somebody watching this program, if they go tomorrow to your office, they could have a brand new upper and lower set of teeth this week.
That is correct.
Is that true?
That is true. That is absolutely correct.
Now the other thing, okay, so implant dentistry, I guess how it's typically done, correct me if I'm wrong, is you go to one place that maybe does the imaging center, then you go to another place where the surgeon does the implants, then you go to another doctor that puts the teeth on top. You do it all right there. I mean, you have a 10,000 square foot institute and facility, so it's all done right there.
That is correct.
Is that why you do it so fast? Because you have your own lab and you have
Part of the
everything.
reason is, yes, because the idea is to give the patient what they want. They want to be able to eat. They want to be able to chew their food. They want to be able to function well in their lives. Functioning means that they should be able to do things that everybody else does normally in their lives. And to provide them with that, my facility has got pretty much everything that I have to do to make their teeth.
Okay.
And those teeth are teeth that patient goes back home and they slowly start to chew their food. They start at a slow pace.
But you sent me videos where people are eating apples.
That is correct. Because
their
these
front
are
teeth.
patients.
Okay.
So this guy that I showed you one of the videos of, he's a guy who had the implants done, and he was just afraid, and he came for his post-op evaluation, and my girls tell me, this is, Dr. Panjali, he's not really eating anything. I asked him, and he says he's not eating.
Because he was afraid. Okay,
I'm just afraid of eating anything.
What'd you say to him?
And I said, this is wrong. This is absolutely wrong. I said, you have to start eating something. And he says, no, doc, I'm just afraid. I know I've had dentures before. I've had this. I said, these are not dentures.
You gave him an apple.
And I gave him an apple, and I said, bite on it right now. He says, are you sure? I said, yes, I am sure. I want you to bite in front of me so that you can go back home and lead a normal life.
And you videoed it.
And I videotaped him.
That's a good
doing
one.
that. And I do this to a lot of patients, because sometimes when these patients who have been wearing dentures for a very, very long time, they feel that they can't eat anymore. Especially these denture wearers who come to me after 8, 10 years
Yeah,
of
but
wearing
isn't it true?
dentures.
I mean, if you've been wearing a denture for like 10 or 15 years, you don't have enough bone to do this.
No, Randy, that's not true.
Okay.
We have patients who come in with very poor bone. They've been denture wearers for a very long time. They have been told that they don't have sufficient amount of bone or soft tissue. There is always something that we can do. We are fully skilled as well as equipped with the latest technologies that can help rebuild the lost tissue for the most part.
Okay.
And there are very rare instances. I can probably name them, probably count them on my fingers, where I have probably said no to somebody. But it is extremely, extremely rare that we say that to anybody.
That's good. That's good. Now, we're going to take a quick break. We come back a little bit more about the process.
Sure.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
I was one of those adults that was deathly afraid of dentistry, so I let myself go for years and years and years, and finally got to the point where I couldn't stand it anymore. I couldn't chew, couldn't smile. It was kind of affecting my social outlook on things. Of course, I couldn't eat what I wanted to eat. It was just starting to affect me overall. I think I'm about 10 years now with the implants. It's just totally turned me around. I mean, I'm back to being humorous again, and I don't shut up anymore like I used to be. People have really noticed that, so I think I'm just back to being who I was. I mean, I can eat apples now. I don't have to cut my pieces of meat so small anymore, and Just I'm back to eating what I want to eat again. I'm back to where I want to be. I wish I hadn't gotten as far as I needed to have implants, but now seeing that I did, I'm glad I had it done. I'm able to smile and I don't shut up anymore.
My teeth were decaying. I was temperature sensitive. That was the really tough part. Cold foods like ice cream or something like that, I couldn't enjoy that. I would bite into certain foods and be in excruciating pain. I came to Dr. Panjali and he helped me. We talked about it at great length and what we were gonna do for the implants. It completely changed everything. They're still in there, they're healthy. I could eat a steak now. I'm biting into apples. I mean, it's life-changing, to be very honest with you. I feel great about it. I enjoy vegetables. Salads, things like that. Those were really tough, like eating raw carrots, celery, things like that. That was difficult for me, and so it's helped me physically as well. You know, a healthier diet, you feel better, you're more alert. Everything. It's again, like I say, it's life changing. It's amazing. We have fun here at Watertown TV7, Watertown, New York, and I do that once a week on Fridays, and enjoy that very much. And it's fun. You know, I wasn't smiling. I smile now. So that's very different for me. It changes everything. It really does.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, nobody should be wearing a loose-fitting denture. They could get a brand new set of teeth, literally in a couple of visits to his office, walk in with no teeth, walk out with teeth that don't come in and out. Dr. Panjali, welcome back to the program.
Thank you.
So that's not an overstatement, what I just said.
No,
that happens all the time.
And that happens all the time.
And you could be like 90 years old and do this, you said?
Oh, yes. My oldest patient is 92 years of age.
Why would a 92-year-old want to do this?
Because you want to eat and chew.
Okay.
I mean, that is the basic fundamental reason
Obvious.
why we all
Okay.
have teeth, is to be able to chew and live a good, healthy life.
So what was going on with this 92-year-old? She had an upper and lower denture?
No. She had her own natural teeth in the lower arch, and her upper arch were where she was having the dentures. So
Okay.
I told her, I said, I can, in order to save you some money and everything, I can fix the bottom arch, and then we'll give you implants, full arch implants on the top arch. And that's what she did. And now, Randy, she can eat and chew anything she wants to.
Okay, good.
I mean,
good.
this is just what we do every single day. And age has been always a question. People come and ask me, is age a factor? Am I a good candidate? Of course you are a good candidate. You can be 92, or you can be 52, or you can be 22. Everybody is a good candidate to have dental implants.
I don't want to rush you here, but we have a few more minutes left. Time for a couple more photos. What else are we looking at?
So here I have this man, he runs a local band there, and he came to my practice and he says, Doc, I can't wear dentures and I'm losing my teeth, right? You've done everything, I've had crowns, I've had root canals. I think it's time for me to go to the next step. So Randy, he is a singer in a local band.
Okay.
I mean, this is his band, and his main objective was that while he's in treatment, he should still be able to sing.
Okay.
And he told me, Doc, can you give me something that would allow me to be able to sing while you're treating me? And I said, of course I can. And he says, I will never have to take it out. I said, no, you don't have to take it out. I'll give you something fixed. You'll be able to sing.
Like a whole brand new set of teeth.
Like a whole brand new set of teeth. You can sing, you can do. And I just told him, just take it easy for a few days, eating and chewing and stuff. But as far as singing is concerned, you can do whatever you do on every single basis. And he was going and singing every day, and he was happy. And
so one afternoon he gets that.
And one afternoon he gets all beautiful smile that he has. And now he's a happy person, and he says, I can smile. When he was singing before, he would, try to hide his smile.
Yeah.
Now he doesn't. He's smiling all the way, all the time.
Is this one of those things where they say, I should have done this years ago?
Yes,
You
it
say
is.
they say this to you a lot.
Absolutely. Every single time. When I am, one of my biggest gratifying moment as a dentist is when I see these people, when I show them their teeth in their mouth for the first time, and they look at that mirror and they say, oh my God,
Okay.
is this really me? I have seen people choking up. I see people literally crying. And I can show you a case where this lady walked into my office. Her husband is my patient. Tells me, he says, Dr. Panjali, my wife has got really bad teeth, but she's very, very scared of the dentist. Can you sit down and speak to her and talk to her?
Okay.
And I said, sure, bring her in. Her appointment was at 1 o'clock in the afternoon. And I cannot, this has been almost 12 years now, but I still remember it just like yesterday. 1 o'clock her appointment. For 4 hours, this woman was sitting in my parking lot in her truck, fearful, coming into my practice. Her husband tried her best. She wouldn't come in. She says, I'll come in.
Did you go out there and get her?
I didn't get it. But,
Okay.
you know, at 4 o'clock, she comes into my reception. At 5 o'clock, she's in my chair. And I finished with my last patient. I walk into the room, and literally she sees me, and she jumps out of the chair on her knees, and she starts crying like a baby.
Okay.
And she says, please help me.
Wow.
She says, I said, get up. You don't have to do this. I am here to help. And I sat her in the chair. She kept crying, and she was just watching, you know, back and forth, looking at over her shoulder if my assistant is there. And I told my assistant, just all of you leave the room. Just leave me with her and her husband. So we sat down, and she spoke to me. And one of the very important things that I've learned in this trade is that if you want to do something good for your patients, you have to learn how to listen. Not just talk, but listen to them, what they want,
Okay.
what their fears are.
Very nice.
And when I did that, she immediately, we had a conversation. She immediately made an appointment. I told her, I'll take you into sedation. I'll do all your work. When you get up, all your bad teeth will be gone, and you will have a new set of teeth.
That's nice. That's a
Okay.
good story.
And after I was done, we brought her back and to a consultation room where I gave her something to eat and drink. And I said, tell me, how do you feel about this new smile that you have? And she looks at, and she started crying again. She just hugged me. Next day, she was bringing me cookies, cakes, and all these things. That it just went on. But what I'm trying to say is that it is a life-changing experience for these people. And she's told me when she came, after almost about a week or 10 days, I had another appointment. She came up to me and she says, you have given me a new life.
Good.
She says, I was not going out to parties. I was afraid. I was scared of my smile. I was just, you know, I just felt belittled by other people. I felt that nobody wants to talk to me because of the bad breath that I had and all these years of decay that
So
I
that's
had
all
in my
changed
mouth.
in one day.
And in one day, you have just transformed my life completely.
Okay. Good. Good.
And so these are the things that we see on a daily basis. These are things that I see when consultations come in. I sit down with them and I listen to them. And
Are they skeptical?
Yes, they are. And every time they come in, and when I tell them that they can get new teeth in a day, they say, it's impossible. I said, no, it is possible. It is possible. You know, you have been going, oh, I've been going to these other places. I said, maybe they are, the skill level is not there. Or maybe they don't want to do it. Or I don't know what the reason is. So I tell them that you will get your teeth in one day. And they will be fixed. You don't,
Okay.
They're not going to be dentures that you have to remove in and out all the time. You are going to have teeth that you will be able to chew with. And soon enough, of course, when they come
Okay.
back and see me for the reevaluation, they say, Doc, I'm chewing on carrots now. I've started having cucumbers. I can
So
have a
the
salad
end
now.
of dentures is
End
going
of
to happen.
dentures, absolutely. Dentures should not be worn. Let me tell you this.
Okay.
Dentures is a technology that should have been thrown out years and years and years ago.
Okay.
Because it causes a lot of issues. And all these denture wearers, they lack confidence. They adjust to the dentures.
But I know a couple of denture wearers. They never complain.
Well, they'll never complain to you, you know?
Yeah, yeah.
But they come and complain to me every single time. You know, it's like I'm getting married to these people. Everybody who comes for a denture, it's like long-standing marriage that we have to stick with each other for the next 25 years or 30 years. You know, I see them
Because they get
on
their
and
new
off.
teeth and then they come in to get them.
Their adjustments and relines and all these things, and I tell them, guys, get this thing done. This
And then they
is-
never need to see you again.
Then they don't. You never
Other than
really
a
have to
clean.
see me again.
Other than cleanings and
Exactly.
things like that.
Yeah. They don't ever have to see me again.
So time for one more photo.
Okay.
We have about
so
1
here,
minute.
Okay. So here we have Mr. Wayne, and he
Okay.
came to my office, and he has no teeth at all.
Okay.
And he comes and tells me, he says, Doc, can you give me something that I can eat with, I can chew with?
And he did want a denture.
He didn't want a denture.
Okay.
So I said, yes, we can. And in one day, I get him to be wearing a good, nice smile when he walks out of my office. He has fixed teeth. He doesn't have to take them out. He doesn't have to do, he can eat and chew anything he wants.
Here he is right here, looking good. So if they go to your website, and we're out of time, if they go to your website, they can look at the videos, patient testimonials.
That is correct.
Now, because I know you're a big institute, do they get to see you on the consult sometimes?
They always see me. I'm the
Okay.
person who will always do the consults with them. I do not like to do things twice. Okay, so I would never allow anybody else but me to have the
do the
first
consult.
with these patients, because I want to understand. I want to understand what's going on with them. It is not just about teeth. It's
Okay.
about how they feel. That's very important.
Good for you. So I want to thank you for coming on the show. Final message, somebody watching this, there are two groups of people. The people with really bad teeth and they're going to lose them all. Maybe they're headed for dentures. Or the denture crowd. Maybe they've heard what you had to say, but they're still afraid. What do you say to them?
Come and see me, and I can promise you that what I have to tell you will just change the way you have been thinking. I'll just change the way that you live your lives right now, and the way your lifestyle is, the way you eat, what you are doing, smile, everything will change. Absolutely will change.
Good for you.
Once I have the first consultation.
All right. So you love what you do.
I
That's
love
an
what I
obvious
do.
one.
This
I mean,
is
you
what
really
I
like
live
it.
for. And my practice is all implant dentistry.
That's
We
all
don't
you
do
do.
anything else.
Okay, good.
There's no general dentistry, nothing done. It's all implant dentistry. And because this is what we love doing every single day. We change lives every single day. That's my job. And that is the best satisfaction I get from everything I do. Just yesterday, right before I came to your show, I was doing a case, and this young man that I'm doing a full mouth, he says, Dr. Panjali, you look very excited. I see that in your voice. And as I'm working on him, I said, because I'm seeing the results of my hard work
Good.
and my labor.
very
And very soon, it'll be all yours to enjoy for the rest of your life.
That's good. We'll end there. So thank you so much for coming on the show. Good stuff.
Thank
Good
you.
stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.